I want to spend a few minutes telling the American people a little bit more about the problems that we're trying to work our way through. The WHO has two primary functions. First, it's a regulator and an advisory role and a health emergency and humanitarian aid operation on top of that. Article 6 of the IHR says that each state party shall notify the World Health Organization within 24 hours of all events which may constitute a public health emergency of international concern within its territory. Annex 2 of those same rules provides that countries must notify the World Health Organization of any unusual or unexpected public health events such as SARS, a close genetic cousin of the virus that causes COVID-19. Those rules also set how countries should evaluate when to notify the WHO of diseases of unknown causes or sources. We strongly believe that the Chinese Communist Party did not report the outbreak of the new coronavirus in a timely fashion to the World Health Organization. Article 6 of the IHRs, which was a part of this reform, further mandates that a state party, that would include China, shall continue to communicate to WHO timely, accurate, and sufficiently detailed public health information. That is, there's an ongoing obligation. Even after the CCP did notify the WHO of the coronavirus outbreak, China didn't share all of the information it had. Instead, it covered up how dangerous the disease is. It didn't report sustained human-to-human transmission for a month until it was in every province inside of China. It censored those who tried to warn the world. It ordered a halt to testing of new samples, and it destroyed existing samples. The CCP still has not shared the virus sample from inside of China with the outside world, making it impossible to track the disease's evolution. Not making a legal determination here today on China's adherence to the IHRs, but the World Health Organization's regulatory arm clearly failed during this pandemic. I'd also note that when countries adopted these new rules in 2007, we also gave the Director General of the WHO encouragement and the ability to go public when a member country wasn't following those rules. And that didn't happen in this case either. That's why we continue to insist this is an ongoing requirement for transparency and openness according to the WHO rules, and the WHO has responsibility to continue to enforce them today. This transparency and getting it right is critical to saving lives today and in the future.